If you have a great insurance agent, like I hope I am, and your agent sits down with you, explains your policy to you, and tells you if you are admitted to the hospital overnight, you will pay this amount of money. Now, something happens and you're in the hospital. You have a heart event and you're in the hospital for 4 days. And you know what you're going to be charged because your agent explained it to you. But then you get the bill and it has no relation to what you were told you'd pay. So immediately you're mad at your agent, and I've been that agent. Jim, one of my clients up the road, he brings me a stack of bills and he's like, something's wrong here because you told me I'd pay this and I'm being charged this. And I said, it's a mistake. They coded it wrong. It's a billing error. We'll reprocess it. Don't worry about it. This is years ago. It was like 2013. And lo and behold, he was billed correctly. Everything I told him was also correct. But the sleight of hand, I don't know what a nice way you can say it, but the shakedown happened at the hospital's level. And this is impacting millions of people that are on Medicare, and it might impact you, your family, your friends. So thank you for watching this video, and I hope you never have to use this information. I was recently published in the Certified Senior Advisor Journal. So I have an article here that if you would like more information, you can ask me in the comments, email us, or call us. We'd be happy to send this over to you if you actually find this topic interesting. So, and I kind of laugh because this stuff is like extremely frustrating. Let me cut right to it. I have a heart attack. I go to the hospital. They put an ID badge on me. They put me in a hospital gown. They put me in a hospital room. I see a doctor. I have stents put in. I see a specialist. I might get therapy. I'm there for 4 days, and I go home. And I find out I was never admitted to the hospital. I was an outpatient. I was held under observation. And you're like, that's not possible. Everything that happened to me appeared to be an inpatient. Therefore, I should have been billed under the inpatient provisions in my policy. No. The hospital can determine if you're an inpatient or an outpatient. And it has no relation to how you were treated. There's not a special wing for outpatient. Outpatient has the connotation, the assumption that it was temporary. And that's how it was meant to be. But due to hospitals trying to maximize their profits and minimize their penalties from the government, you might be penalized. You might lose benefits because you weren't actually admitted to the hospital. Now, this really hurts people that have a Medicare supplement plan that are not able to then be transferred to a nursing home and reap the benefit of their Medicare supplement insurance, which should pay a good portion of their nursing home stay. And it will not unless they were admitted to the hospital for at least 3 overnights. And you're saying, I was there 7 nights. I was there 15 nights. Why can't I use this provision in my Medicare supplement insurance? I paid those premiums each and every month. Why can't I have that right? Because you were not admitted to the hospital. But I was in the hospital. I had the ID badge. I had the gown. I had surgery. I had a specialist. Doesn't matter. The hospital coded you as under observation. You were an outpatient. You were not an inpatient. So what can you do about it? It's not appealable. Yeah, you heard me right. It is not appealable. As of right now, which is October of 2019, it is not appealable. There's nothing you can do. You have no rights. There is a lawsuit that's working its way through the courts that you could potentially join the class action if you've been harmed by this. But until that winds its way through the courts, there's nothing you can do. The best thing you can do is arm yourself with the knowledge. And people say, well, if this is my father, or this is my husband, or this is me, and I will demand to know if I'm admitted or not admitted. Okay, you now have that right, which you didn't for years. You didn't have the right to find out what your determination was. Now they have to give you a notice and tell you that you're being held under observation, and these are the reasons why. Okay, so that's a step in the right direction, even though it has no bearing on your situation, because you cannot demand to be admitted. I've had people say, well, I'll just leave that hospital and I'll go to the one across the street and I will demand to be admitted there. You can't do it there either. You have no right to be admitted. They're going to treat you the same. It's going to be the exact same level of care, so that's good. But how you pay for it and the ramifications are out of your control. So I hate to bring up situations like this where there's no answer, where I can't actually help you and guide you. All I can do is arm you with the information that this could happen to you. I get clients that call us, say, I need a new insurance agent because my agent told me that if I was in the hospital overnight, it would cost me this much per night, and it didn't. And my agent told me that if I was in there at least 3 overnights and I had to be discharged to a nursing home facility and I needed skilled care, that I would receive so many days for free, courtesy of my Medicare supplement insurance, and I didn't. I had to pay $5,000, and I hate that agent. I want to work with you. Now, I'd like to work with you too, but I'm also going to tell you that agent told you correctly. He was a good agent, and you're unjustly blaming him for a system that's not just. There is legislation pending every year for the last 8 years to try to make this better. And they've made little changes, nothing's made it better. To undo it, that's not done. But there's always legislation, there's probably some pending right now. So chances are this could go away at some time in the future, but don't count on it. If you'd like more information on it, like I said, email us, call us, we'd be able to give you the paper. Or the best thing I can do is just tell you this might happen. What your policy says and what your agent told you might be correct, but due to the hospitals refusing to admit you, you might be charged more or less than what you anticipate. Sorry, I hate it when I have to do a video training like this that doesn't have a happy ending. Stay tuned next week when hopefully I'll have a better video for you. Subscribe to our channel if you never want to miss fascinating topics like this on Medicare, and thank you for watching.